Hello, my name is Dr. Robert Arnone. I'm an upper cervical specific doctor, also known as the brainstem doctor. Here to talk with you today about Alzheimer's disease. Alzheimer's generally affects the elderly. We kind of are familiar with people in their 60s, 70s, 80s, 90s having Alzheimer's, but actually we see it in 50s, 40s, and younger, actually even forms of children's Alzheimer's in young kids. So what is Alzheimer's? Basically, it's a progressive degenerative neurological condition where certain parts of the brain start to degenerate faster than others, and so any function associated with that will start to diminish. So what we see is the area of the hippocampus and the frontal lobe that degenerates, and so now we look at things like intelligence, speech, judgment, memory. They're all affected. Now, what I'd like you to understand is how the brain works correctly. So it starts simply like this. We have a model here of the base of the skull and the bones of the upper neck. This is the back view. Inside the skull, we have the brain. So the bone encases the brain and protects the brain. Inside the spinal column, we have on the top the lower brain stem, and then as we get to C3 and down, the spinal cord. And so it's very important, so it's encased in bone. The difference is the spine itself is movable, and especially this upper area right up here, the upper cervical spine, this is surrounding the most important part of the whole body, that lower brain stem, because this is what sends continuous impulses up to the brain in order for the brain to work correctly. And so when it sits in a comfortable position, because these bones are all lined up properly, we're going to have good function. We're going to have good impulses to the brain, and we're going to have good brain function. The problem is, though, from head-neck injury of various sorts, and it could start way back at birth when pulling on the head and neck to get the child out, to get the shoulders out. Many times we get that first subluxation, that pressure up there. But on top of that we then have falls, sports injuries, concussions, car accidents. All kinds of different traumas can occur to then set this in motion even faster. Sometimes it's cumulative, sometimes it's more than one injury. And so what happens is, instead of surrounding and protecting, like you see here, now we shift and we start to twist, and bones shift into the wrong position, and now it compresses and actually chokes off the impulses that are trying to get up to the brain. And if that's happening, whatever part of the brain that's not being fed correctly slowly starts to die. And so we see that again with the hippocampus and frontal lobe higher up in the brain. We see that degeneration. Now, what we said earlier, this can happen in children, this can happen in adults. Again, there could be pressure on that brainstem from birth or from an injury when the child is young that doesn't allow the impulses to get to those parts of the brain, and we see those things malfunctioning. How can that be helped? Well, typically people go to a medical doctor and eventually different types of doctors like a neurologist, and have different tests done and then have medication given. The problem with that is when they take the medications after they've been diagnosed with Alzheimer's, they do not get better. This is progressive, and what they do with the medication is it's an attempt to try to slow it down, the progression. In some cases they can slow down the damage, but it does not stop it, it does not reverse it. And so that's not a real great ending. This, what I'm suggesting to you, is not a treatment necessarily for Alzheimer's as much as it is a looking into correcting the upper cervical spine to allow the best impulses to get from brainstem up to brain, to give the brain the best possible chance for proper function. And so if you're somebody who's anywhere near St. Louis or the Midwest, you can certainly come out and we can talk and we can look at you and see if we can help you. If you're someone who might be a little further away, where it might be more than a car ride and it might be a plane ride or so, well, if you have pictures taken of this head neck area, MRIs, CAT scans, x-rays, you can send them to me digitally or physically, and I'd be happy to analyze them for you and let you know if you have a problem here. This is not something that will be diagnosed by any other doctor. It's not diagnosed by neurologists. It's not diagnosed by the medical doctor. It just won't be diagnosed by anybody else other than the specialist like myself. And so you're not going to be told about this by anybody else but a specialist like myself, or possibly someone who's improved from this care. So let's talk. Leave a comment in the box associated with this video, and let's see if we can help you too. Until then, take care and God bless.